Hello, everybody. I hope you're doing well. I'm sorry I could not join you all in person, but I am very honored to be able to speak with you all by video. I want to start by giving a special thanks to Kaylee Madormo from the Catskill Hudson Area Health Education Center, as well as Karen Driscoll from the Catskill Addiction Coalition for inviting me to speak with you all today. As we all know, addiction is a disease that can upend one's life as well as strain relationships with loved ones, family, and friends. We must keep working at all levels of prevention, treatment, and recovery services, and we must continue the conversation around harm reduction and how best to support healthy communities. New York's 19th congressional district is the 8th most rural congressional district in the country, and it has some of the highest overdose rates in New York State. On Monday, the State Department of Health issued an update showing that opioid overdoses continue to claim the lives at a high rate in 2021, after a record number of deaths statewide and nationwide in 2020. In the 9 months of 2021 that New York State has complete data for, Columbia County, Greene County, Montgomery County, Schoharie County, all counties in my district have exceeded their death toll for all of 2020. These staggering numbers reiterate the need to address this epidemic with every tool we can. Since the beginning of my time in Congress, I've made addressing substance abuse and specifically the opioid crisis in our communities a top priority. And I've held multiple events all across the district to highlight this issue. I'm a member of the bipartisan Heroin and Opioid Task Force, working with my colleagues to prioritize better understanding and addressing this public health crisis. I've visited substance abuse and medical treatment centers across the district, and I've heard directly from patients, administrators, and providers about how they provide treatment and care. Given the other challenges that we've faced, like COVID-19, which has exacerbated this crisis, we must keep working to provide funding and support directly to communities to address substance abuse disorder and work to rebuild recovery-friendly communities and reduce the harm and stigma associated with substance abuse. The recent government funding bill, which I was proud to support, includes significant investment in substance use, treatment, and prevention. Overall, Congress provided $3.9 billion, an increase of $99.8 million above last year's level, including continued funding for opioid prevention and treatment and recovery. This includes $1.9 billion, an increase of $50 million for the Substance Abuse Prevention and Treatment Block Grant. It includes $1.5 billion for the State Opioid Response Grants, $35 million for the Pregnant and Postpartum Women Program, $13 million for Building Communities of Recovery, and $101 million, an increase of $10 million for the Medication Assisted Treatment Program. We want to continue, and we must continue supporting our community partners. In 2021, the Biden administration shifted the federal government's approach to drug use and endorsed harm reduction as an evidence-based approach to reducing the deaths and morbidity that can arise from addiction. We are finally moving in the right direction with treatment and prevention rather than criminalization. Harm reduction funding is used to distribute overdose medication, curb infectious disease transmission, and go after those who are bringing illegal drugs like fentanyl into our communities. I support this approach and have my own legislation to address substance abuse in a more holistic way. I introduced H.R. 1384, the Mainstreaming Addiction Treatment Act, legislation that would end an outdated redundancy in federal law that restricts healthcare providers from prescribing buprenorphine, a proven treatment that has helped countless Americans suffering with a substance use disorder. While providers can currently prescribe buprenorphine for pain management, they are forced to go through a burdensome process to apply for a special waiver from the Drug Enforcement Agency to prescribe it to treat addiction. It is time we end these backward policies that make it harder to prescribe addiction treatment medication than it is to prescribe the opioids that are addictive in the first place. The rural nature of our region and district makes transportation a barrier for folks to access resources and recovery services. Last year, we passed the bipartisan infrastructure law, which provides a major investment in our public transportation and works to improve our roads, our bridges, and our highways, making traveling safer and easier in terms of accessing these critical health centers. If folks are having trouble accessing transportation, people also reach out to my office and we can help individual communities find grants and other federal resources. Related to transportation, there's also the question of broadband. As a member of the Rural Broadband Caucus and founding member of the Rural Broadband Task Force, I'm deeply committed to partnering with my colleagues and the administration to be a part of the solution to ensure folks in our district are not left behind because of where they live. The bipartisan infrastructure law also included historic funding for broadband, $65 billion to work on closing the digital divide, the largest investment in broadband in our country's history. There are other things that we could also do, including fixing the FCC's broken maps, which only focus on densely populated areas when thinking about who has broadband and who does not. Obviously, this is a bias against rural communities we must change. Folks in our most rural areas should not be left behind, and they must be able to utilize telehealth for treatment help. Without broadband access, they can't do that. And it's made even more challenging when we have in our rural communities so few recovery facilities to get the treatment in the first place. Addiction, to be clear, does not identify with a political party. It does not discriminate against those it affects, whether it's urban folks, or whether it's folks who live in rural areas, high income, low income. It doesn't matter. This is a devastating issue that is plaguing our communities of all sizes. And I'm going to keep doing everything I can to address this epidemic. It's an epidemic that is impacting families and loved ones all across our country. I want to say that I appreciate the work that all of you do to address this issue head on, doing so with compassion and with holistic approach. And I'm with you every step of the way. Please stay safe, stay healthy, and God bless.